Well, for those of you that are on now, you can get the story from the beginning. For those of you guys that are not on now, well, if you come in halfway, it'll be recorded. So, greetings from the middle of nowhere. Why, Dr. Niemiec, you may ask, are you scruffy with a week's worth of growth and wearing a t-shirt that says life is better with the dog, and a hat, and drinking a sparkling water? Well, I'm glad you asked. I had a very interesting morning. It started out when I was driving to my next place. And the reason that I didn't shower and shave and do all that is because there's a real shower in my next location. And oh, by the way, if you're not following my adventure, my RV adventure to take care of our satellite clinics, follow us on Facebook at Veterinary Dental Specialties and Oral Surgery. So I'm driving along, and just so you know, this is our studio currently. So there's Sage in her little bed, my camping chair that I'm sitting in because I brought it along, my Cruise America RV, and currently, thank you Starbucks, who are going to throw out a little thank you. This Starbucks is currently closed thanks to COVID. But luckily their Wi-Fi is still working. So I have I have to buy a latte next time I go into a Starbucks. You don't normally do that thanks to keto. Thank you Starbucks. I'm going to throw a little ad in here for you guys because I'm using your Wi-Fi tonight, whether you agree or know it or not. So Dr. Niemiec, why are you in the middle of nowhere doing this from a parking lot with your dog in her bed? Well, if you see down at the very bottom, you'll see Sage. If you follow Sage, you'll see her her bowl. And then if you go down below that, you see a rock. Why do I have a rock? Well, I was driving through the middle of nowhere. There you go. That's I-15 in the middle of nowhere on the way out to Las Vegas. And so I pulled off on a road to let Sage take a walk and to pee and to stretch my own legs because between Vegas and Dublin is 9 hours. So it's a long drive. So I went down this dirt road, and don't ask me how this happened. And I have talked to numerous people that they've never heard of it, but I got that rock that you see right there stuck between the rear tires of my RV. And so it went boom, 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 every single time that I would go anywhere. So I was about a mile down this dirt road. So, and I had, of course, zero service. So I drove out to back where the highway that I'd pulled off on was. I called the company and they said, well, because you went off a standard road, we're not going to cover you. We're not going to help you. I'm like, okay. They're like, we can give you the number of a tow truck, but you're going to have to pay for it. Okay, well, I have AAA, right? So I called AAA, and it's a long, long, long story. And oh, by the way, if you guys want to hear this story in its entirety, I'm going to record it as a podcast, and it'll be on my website along with some of my other good stories that I'll record later. But the bottom line is, eventually, by calling a whole bunch of places, I found somebody that a tow truck that could come out and jack it up, decrease the tire pressure, get the stone out, and then go from there. But what the guy said was that, you know, the problem is that might have damaged your tires. And if it's damaged your tires, then I'm still gonna have to tow you, or we're gonna have to call somebody out to replace the tires. Good point. So I said, what's going on? And he goes, well, there's a company that is a mobile tire service, and it's a mobile tire service, and they can come to you and do the same thing I would, jack it up, take the stone out, and if your tires need to be replaced, they can replace it. Well, that sounds brilliant. So I called them, and they're like, yep, we can do that. What kind of tires do you have? So I put them in my truck. And so we put him in the truck, and he drove out. The problem was, again, I was in the middle of nowhere. It was a little over an hour for him, about an hour and a half for him to drive from where he was to where I was. And so unfortunately, that cost me about 4 hours this morning on my drive. So now, unfortunately, I am in the absolute middle of nowhere. But thank you, Starbucks. I am doing that. And so Argo, no wine tonight because I still have driving to do when I get done with this lecture. So here we go. I'm drinking sparkling water. And now we'll go start talking about actual feline dentistry, which is what you guys care about. So, books, like I talked about, if you really want all the information that's in this lecture and so much more, including radiology, extractions, pain management, anesthesia, the Feline book available on our website, it covers everything that's in this lecture tonight. It's a really nice thing for you to go back to. All right, cat dentistry. People love cats and people don't particularly love cats. And because cats are a challenge, they are. They're not small dogs. You know, we talked about this, and little dogs aren't small big dogs either, but cats aren't small dogs or small people. They do have fairly unique problems that we don't see in other species, and we're going to talk about the eosinophilic granuloma, although you do see that in some dogs. And they are less affected by the common dog diseases. You know, dogs get a lot of broken teeth because they're big dumb dogs and chew on things that are too hard, and dogs get a lot of periodontal disease because they're little dogs and they are prone to it. So from that standpoint, they do have their own unique stuff. And I say this all the time. Cats don't read textbooks. They don't. Dogs appear to. I'm not saying that dogs are smarter than cats, because I know there's a lot of cat people on this, but dogs tend to go, oh, this is how things are supposed to be treated? Sure, go ahead and treat me like that. Cats, on the other hand, yeah, no, not so much. They don't read textbooks. You can try something and it won't work. And things that work on one cat may not work for the next one. So, you know, be prepared for your initial assessment to be proved wrong. So that's kind of an issue. I'm not sure why people are calling me. I am going to actually mute that. So bottom line is, cats often have unusual presentations, and we're going to help you get through that. So cats will almost never stop eating because of their mouth. And I said this in the first lecture that we had, the ER lecture. I want to just stress it. Cats are not going to stop eating because of their mouth. I've seen the most horrific mouths, and the cats eat right through it. The big thing is, you have to work these animals up. And I will tell a client who owns a cat that if we don't see stomatitis, I would get full body x-rays and I would get a full blood panel, and I would even consider doing like things like ultrasound before I would blame the mouth for it. The one exception to that rule, that's caudal stomatitis. We'll get to that towards the end of the lecture. That is the one thing that will really stop these cats from eating. So really, like we talked about in the ER lecture, I'm not going to, to talk too much about this, but you definitely want to be doing preoperative blood testing, and you definitely want to include a UA, especially in cats. And the reason I tell people this, the reason that I do this all the time for these cats, is because cats live on the edge of being dehydrated. And so it's quite often for me to get a blood panel and have a slightly elevated BU and creatinine. And then if we get a urinalysis, the specific gravity is 1050. So they live at on the edge of that. So for me, the reason I really want to know about their levels of kidney function is because I, like I talked last time, really like non-steroidal anti-inflammatories in cats, whether it's Onsior or one dose of Metacam. But again, if you have kidney issues, especially the Metacam size, you need to think about it. So please get a UA, especially in your kitties. And I do like chest x-rays. I really do. We have started, like I said last time, running cardiopets. I'll be honest, not very often in cats. They hate the EKG leads. Dogs, I have a problem. Cats, if I have any concern, I will do that. And really, you don't see HCM. You really don't see it very often. A lot of times you want to sculpt it, but we do find in our experience that a lot of patients have significant findings on chest films that would help our anesthesia. So talking about actual things that you should know about cats. Endodontic disease. And again, like I said before, dogs are much more prone to getting endodontic disease than cats are. There's two main differences. Number one, this is the big thing for a general practitioner nurse to know. Cats have almost no tooth, almost nothing between the tooth and the root canal. So any fracture, any fracture in a cat should expect it. You should expect to have direct root canal exposure. So even if it's just the tiniest little tip, you should be thinking about it. So you look at this. You guys see this all the time, right? There's a little chip fracture. Not a problem, right? Not necessarily. You need every single time that you see this little tiny chip fracture in the canine of a cat, you need to put that cat under anesthesia. You need to take an Explorer or an endodontic file, which you guys don't have, but the Explorer into that probe, we talked about that before. And if you feel stickiness, if it's not, you know, hard and through the whole thing, if you see any stickiness, you absolutely need to get an x-ray, and you should x-ray it anyway, because here it is. It looks benign, and I did probe it and it looked fine. And then I x-rayed it. And what you can see is that all that root's eaten away, huge amount of infection in there. So the big thing to remember about cats, any fracture in a cat probably exposed the root canal. So always get these patients under and take care of these teeth from the get-go. The other thing about endodontic disease and cats, which is not as much important for general practitioners as it is for us specialists, is that if you have a chronic infected tooth, if you have a dog that had a tooth that broke 6 months ago or 6 years ago, in general, even if it abscesses, they will eat the bone away, but it won't eat the tooth away. So as long as the tooth is in good shape, it can still take a root canal. Cats, Cats tend to eat away their teeth. So if you see an abscessed tooth in a cat, or if this is a long-standing infection in a cat, generally what they're going to do is resorb the root, so we can't do a root canal. Again, if you're going to extract it, it doesn't really matter, except for to know that it's going to be more difficult to do it because this is going to be resorbed. So there you go. Here's your x-ray of that. And what you can see is you've got peri-apical down there, but you've also got your root tip being eaten away. This is not going to take a root canal very well. It's going to be a pretty easy extraction because it's kind of being extruded. But if this was a client that really wanted to save the tooth, it would be unfortunate that they couldn't fix the tooth. So when you see those fractures in cats, get them treated as soon as possible. So let me go up here. I did see a couple questions. Let me see if I can answer the questions. Yes, a link to the recording will be sent out after the webinar. Maybe in about a week or so. I'm going to be not really available to be doing these things for the next little bit, but yes, we will. Unfortunately, the last recording wasn't great. I'll probably get that up online, but I may re-record that. Susie wanted to go back to the x-ray. I'm not sure which x-ray that you wanted to see, but I will go back. I'm assuming you wanted to talk about this one and all the resorption within the root canal here, and all this bone loss down here on the distal aspect of it, and the fact that it's all being eaten away. And that's just a case that it's been infected for a long time, and we simply can't fix that. And again, it's going to be fixed from there. Okay. All right, moving along here. Feline tooth resorption. And I ask this all the time, and I can't see people raising your hands. And oh, by the way, I see raised hands in this. Just ask a question. I'm not going to respond to the raised hands because I can't, but I will respond to the questions and the answers. So feline tooth resorption. Does anyone like taking out cat teeth? There's very few people that like taking out cat teeth. Why? Because generally when we're taking out cat teeth, it's because of tooth resorption. So Leslie, I see raised hand. I can't see anything there. Just there's a Q&A. Ask me the question. I'll come to it at the end of the thing. So feline tooth resorption is incredibly common. Depending on what study that you read, somewhere between 20 and 60% of cats get it. The only thing that is a risk factor for developing tooth resorption in a cat is getting older. Cats that they don't get it young, I've seen it young, but the older the cat, the more likely they are to have it, and those cats that get them tend to get more. They are incredibly painful once they get above the gum line. And we don't know why they happen. We have absolutely no idea. But what you'll see, the first thing that you're going to see when you're looking at feline tooth resorption, you see this little red spot there? That little gingival enlargement, that little growth right there, that is your sign that you probably have tooth resorption going on underneath there. So from that standpoint, if you see any lumps or bumps in a cat, you see anything that looks like that, That's your sign that there's a tooth resorptive lesion underneath there. And I would get that pet under anesthesia and I would probe it and I would explore it. Again, take that explorer and find it. Any roughness is going to be a sign that there's a tooth resorptive lesion underneath there. Now, this is a normal dental radiograph of a cat. And I put this in here so you guys can compare to what you're going to be seeing in a few minutes when you actually look at this cat. So cats that have resorption. So what you should see is a nice root canal down the middle of the roots, and that thin black line you're seeing around all those premolar teeth, that's the periodontal ligament. When you are extracting a tooth, quote unquote normal tooth, what you're doing is stretching and fatiguing the periodontal ligament. In dogs, most of the time that's what you're doing. In cats and old dogs, you get into this nasty thing called ankylosis. Ankylosis is where the periodontal ligament is lost and the tooth and the bone fuse into one. And I'll show you some x-rays of that in a little bit. That's where your extractions get really challenging. If your x-rays look like this, you wouldn't hate cat extractions. The problem is dogs, or cats that have tooth resorption, it's miserable. So, tooth resorption in cats. The first thing to know, any lumps or bumps, any little gingival enlargement, that's the sign that there's a tooth resorptive lesion in there 99% of the time. So if you see that, get them under, probe it. No matter, and again, I don't care if they don't need a cleaning. These tooth resorptive lesions hurt, and these patients need to be treated. So anything that you see that is any indication that there's a tooth resorptive lesion, you need to get that pet under, examine it, and x-ray it. So here's a cat. This is my favorite example. This cat had had a dentistry done. See how beautiful it's clean. Had a professional dental cleaning done. And that's the correct ABDC terminology. And they found this little growth. You see the growth in between the canines. So they referred it to me. You can see how nice and clean the teeth are. So if you look at that, you can see just a little bit of a bump there on that lower right canine. If you look at the lower left canine, do you see that? Just that little bump, that little bit of gingival enlargement. That to me, if I saw this cat and it was an awake exam and it was in my exam room and I was like, hey, you know, I'm taking a look at your cat. If I saw that, that one thing right there would be enough for me to go, this cat needs to be under anesthesia and needs a probe, okay, plain and simple. So when I got this cat under anesthesia, here's your x-ray. So what you can see is there's that little bit right at the gum line, but look at how all that root's resorbed. We talk about what you can see in the crown of the tooth as the tip of the iceberg. If you can see anything in there, it's destroyed. So this is a complete ankylosis and resorption. There's absolutely no periodontal ligament around there. Unfortunately, there is still a root canal in there. So this is kind of your worst case scenario. This is kind of your miserable time. Why? Because you still have to get most of that tooth out because that root canal is still there, but it's completely resorbed. So if I was treating this case, if I was doing it, I would call this a modified crown amputation. So I would take out most of the tooth. I think you can see better now. I would take out most of the tooth, but I wouldn't. You're not going to be able to get down to the tip. So you're going to have to do it surgically. This is miserable. Honestly and truthfully, I'd refer this if I was in general practice, to be honest. Okay. So when it comes there, so that's one of the main reasons to be using x-rays when you're talking about cats. But the other reason is we need to know how to treat tooth resorption in cats, because ideally we would extract these things completely. That would be the ideal thing. The problem is once we get into this advanced ankylosis, it becomes incredibly difficult to impossible to extract these teeth. So when you look at this, this is a cat, and again, you see that gingival enlargement coming up over the teeth there. Again, I'm going to say that this is a tooth resorption just based on what I can see here. Well, I know we all have heard of crown amputation, and a lot of veterinarians and technicians think of crown amputation for any tooth resorption. Wrong, 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 wrong. You cannot do a crown amputation unless you have x-rays, and there's certain things that you have to find on those dental x-rays to be able to do it. What are they? Well, first of all, you can't be treating caudal stomatitis, which we'll talk about in a little bit. If you're treating caudal stomatitis, you have to get the teeth out, or at least the vast majority of the teeth out completely. But here is a cat with tooth resorption. So there's things that you need to see on x-ray, 4 findings, 4 that you need to find on x-ray. Number 1, No radiographic evidence of a root canal. Well, no, I can see root canals in all those teeth. 2, no radiographic evidence of a periodontal ligament. Nope, I can follow that periodontal ligament all the way around both of them. Number 3, no radiographic evidence of endodontic disease, which would be periapical lucency. And number 4, no radiographic evidence in periodontal disease. So if all 4 of those things are satisfied, you can do crown amputation. If not, you can't. You've got to get it out completely. So this is the x-ray from that first cat. I'll go back to it really quick. So this is the picture, and here's the x-ray. So you can see in the crowns the big Pac-Man chomps out of there. But the problem is this cat has completely normal teeth. So these roots must be extracted completely. Crown amputation is not an option for this cat. Good news, it's going to be a pretty easy extraction. Those periodontal ligaments are solid and they're normal and there's no ankylosis. So they're going to be a pretty easy extraction. Okay? Another example of this is this one right here. Okay, again, wicked resorptive lesions here, wicked one here. If we take an x-ray, again, you can see big lesions there. But again, completely normal periodontal ligaments, completely normal root canals. And, oh, by the way, this one's got endodontic disease and periodontal disease. So you must extract these completely. These are an example of a type 1 tooth resorption, okay? This is where there's no replacement of the tooth. That means the tooth is eaten away like a caries would be. It's all eaten away, but the root is not being replaced by the bone. So a type 1 tooth resorptive lesion, and you cannot crown amputate type 1 tooth resorptive lesions, okay? So these have to come out completely. And again, this is gonna shatter as soon as you touch it. It's gonna shatter. But if you leave these roots behind, you're leaving pain and infection behind, and that's not what we want to do. Now, conversely, here's another lesion in a cat, and it looks incredibly similar clinically. So it's got all this resorption here, and it's a wicked resorptive lesion. And again, this cat hurts. He's miserably painful. So we need to treat these. So if you didn't have x-ray, or if you didn't take an x-ray, and you section it, you start drilling, it's going to shatter. Why? Well, here's your x-ray. The tooth in question's on the far left. There's nothing left. This is a type 2 tooth resorptive lesion. A type 2 tooth resorptive lesion has it replaced by bone. So that one of the canines I showed you earlier, the x-rays where it had all that ankylosis, that's a type 2 tooth resorptive lesion. This is a type 2 tooth resorptive lesion. Now, if we follow those rules that I just told you, no infection. Nope, there's no periapical lucency. Oh, by the way, that dark spot you see in the mandibular canal, that's the mental foramina. That's where you would give a nerve block. Number 2, you don't see a periodontal ligament. You don't see a root canal. I don't see any evidence of periodontal disease. And oh, by the way, obviously, this patient does not have stomatitis. So this is happy dance time. This is a crown amputation case. Now, what I tell people, the way I recommend for a general practitioner, you guys want the cookie? What's the easy thing, Brooke? If you take your finger and put it over the crown of that tooth, you can do it right now. Take your finger, place it on the screen of your computer that you're watching it on. Place your finger over the crown of the tooth, okay? The black area, figure it. If you look in the bone, do you see anything that looks like tooth left? No, it all looks like bone. You can do a crown amputation. Vice versa though, if you put your finger over these teeth, you can see how you can still see the roots there. You can identify the roots easily. If you can identify roots, you need to go in and take them out surgically if necessary, but regardless, those roots need to come out completely. If it looks like this, you can do a crown amputation. Hope that makes sense. Now, there's always a but. There's always the exception to the rule. When you have a mandibular case, okay, a mandibular case, those x-rays will show really well whether you can do a crown amputation or not. Not necessarily in maxillary x-rays. So when you do a crown amputation of a cat on the maxilla, always look down into your extraction site and see if you can see any evidence of a root canal left, okay? This is a cat, and I took an x-ray, and it's a 204, and you can see, dude, it's completely resorbed, right? There's just nothing left in there. So I did a crown amputation. I did a modified crown amputation. And that's what I was left with. So I went down about 5 or 6 millimeters, as you can see, and there's mostly bone, but there's this little tiny area, it's maybe 2 millimeters across, that is still intact tooth, and you can see that worm sticking out of it. That's the nerve. So when you do a maxillary one, always look down and see the tooth isn't going to bleed, and it will have a root canal down the middle. And if that's the case, you need to crown amputate further. Okay, so what I did is I went down there further, and I got down, and I got it all out. So mandibular, yeah, the x-rays are pretty accurate. Maxillary, not so much. Okay, so I'll go up and see if there's questions. I see a few. How do I extract roots when you see them on the radiographs, but it's indistinct? Oh, yeah. Caitlin, yeah, that's why people hate cat extractions. If you can really see it, basically there's usually an area that's completely resorbed and looks like bone, and then there's tooth below that. And typically what I'll do is I'll just go down further and typically find it. If it's really, honestly and truthfully that miserable, and you're just like in there going, dude, I just can't see anything that looks like tooth, then I would let that continue to resorb. As long as you don't see any signs of infection, as long as there's no endodontic disease, you really don't see that root canal, then in general, I think you're okay to leave it. Joseph, yes. Do you think I will enjoy extracting cat teeth if I charge more? Yes, you will. And a quick aside on that story, I was told by way back when, this is probably 1997-ish, I was grousing. I was working in general practice. I was doing my dental training, and I was grousing about some procedure. I don't know what it was. I probably dog space, because I hate dog space. But I just absolutely hated it. And I was like, you know, I don't want to do this. And this old horse vet who had sold his practice, because again, it's hard to get a job as a horse vet. And he had worked for a long time, and he sold his practice to my boss, and he came over and started to work with us. He was a great old guy. And he walked, Norm was his name, Norm, of course. And he walked up and he said, what's wrong, Brooke? And I'm like, well, I don't want to do this blankety blank case, and I'm only going to make this and this and this and this and that about it. I'm not charging enough, blah, blah. And he looked at me and he said, Brooke, if you don't like to do something, charge more until you like to do it. And that's true. I mean, if you don't like to do it and it's hard, why not? All right, so the criteria. There's actually 5 criteria to doing a crown amputation. Number 1, no radiographic evidence of a root canal. Number 2, no radiographic evidence of a periodontal ligament. Number 3, no radiographic evidence of endodontic disease or periapical lucency. Number 4, no radiographic evidence of periodontal disease in the area of the tooth you want to leave. And 5, can't be treating caudal stomatitis. If those 5 things are satisfied, you can do a crown amputation. But like I said, you know, put your finger over it. If you can't see anything, then you can probably just go ahead and do a crown amputation just fine. Simon, that's a really good question, and it's somewhat controversial. The question is, if the resorption is only below the gum line, is it painful? You know what? In humans, it's not. So in human beings, it's not painful. So we assume that it's not painful in animals. So plain and simple, I don't treat cases where I can't find anything. That being said, if you see the x-ray, the resorption on the x-ray, and you cannot find it clinically, or you know, you don't see it, always clean the tooth off. There's an important thing. Roughly scale the tooth off, and then go right along the gum line with that Explorer and make sure that you don't have any roughness to it. You know, if I have to finish the crown amputation of the root by going deeper, I'll use the Dr. Tony Woodward trick, and I'll do a little moat around it with a drill, and then I'll pop it out. And yes, somebody asked if large cats get these. Yes, lions and tigers get tooth resorption. Yes, it's the same thing. And then I can't show the questions from other participants, but I am repeating them to them. Basically, yes, large cats do get the same disease syndromes. And really quick, no periodontal disease, no endodontic disease, no radiographic evidence of a root canal or stomatitis, or root canal infection or periodontal infection, and no stomatitis. All right, moving on. Now, this is something that everyone needs to be aware of, mostly for the client's sake. So in cats, they have very tight upper lips, and their upper canines actually hold the lips out. And so what happens when you take out an upper canine in a cat, my experience, there's no studies on this, but my experience is about 30% of these cats will develop tooth resorption, okay? Or excuse me, will develop maxillary lip catching when you take out an upper canine, about 30% of the time. So what you need to do, excuse me, as a general practitioner or technician, when you are having to take out an upper canine, you need to talk to your clients about this before you do the extraction. So this is why I, as a specialist, like to do root canals or periodontal surgery, if at all possible, when I have a cat with a maxillary canine that is diseased. Now, sometimes, like with tooth resorption, or like I told you before, with that really advanced endodontic disease, you have to extract it. You have no option. But this is why, recommending referral for root canal, if it's possible, would avoid this. But for you guys, when you're taking these teeth out, you just need to inform the client that this is a known complication. Because if you don't, the client's going to assume that you did something wrong. If you tell the client, and this is what I talk to my clients about, yes, your upper canine has to come out. There's no other options. It's too far gone, or it's resorbing, or whatever. There's about a 30% chance that this can happen in Brooke's experience. If I'm treating them, I recommend to the client, or I give the client the option of treating the lower tooth at the same time. In general practice, unless the lower tooth is diseased, I roll the dice, take the tooth out, see if something happens. If something happens, then you're gonna have to come back and treat it. What are our options for treating it? Well, glad you asked. So here, keep going, buddy, here. Here it is. I talked about this at all. I already talked about this for those of you guys, that want to read it. It's about a third of the time in my experience. Harder extractions tend to be more likely to do this because you have to take more bone away. So there's more lip falling in. So that's why we try and avoid extractions, and we'll do root canal therapy or whatever. So a lot of these cats, just like a lot of patients with dental disease, they don't show any signs. They just deal with it, okay? Which is unfortunate, because they are painful. They absolutely are incredibly painful. Imagine biting your lip. I mean, dude, how often do you bite your tongue? You're like, ow, that hurts. Well, imagine doing that every time you close your mouth. Some animals show significant signs of discomfort. I had a cat that wouldn't eat because of it. And my classic story, it's really interesting. I had a cat that thought that it was seizuring after anesthesia. So just so happens to be a classmate of mine, who's a neurologist of all specialties. Her cat went in to this clinic that they work at, and they had an upper canine extracted. And the next day, the cat was doing that the whole time, because every time he closed his mouth, he got an electric shock of his tooth going, ow, ow, ow. So she worked him up for seizures, MRI, all this kind of stuff. Couldn't find anything. The cat was miserable. Just so happened that one of my associates was there one day when the cat was there, and he said, well, your cat's chewing on his lip. And she's like, huh? And he goes, well, did this happen right after dentistry? Yeah, I thought it was the anesthesia. Yeah, no. Like your cat's seizuring, quote unquote, because of this. And so we treated it. And TMJ issues as well. So bottom line is the TMJ issues we've seen as, not that it causes TMJ issues, but it's misdiagnosed as that. So this is what it looks like. Here it is. So this is Sid is this kitty's name. It's from a long time ago. And you can see that every time this cat closes his mouth, he bites on his lip. And anyone that's been bitten by a cat knows how miserable that is. And over time, you start getting these lesions here. So this cat's miserable. He's not eating well. He needs to be treated. And every time, he's just absolutely unhappy. So how do we treat it? How do we treat this thing? Well, we have to remove the tooth. We have to remove the part of the tooth that's causing the problem. Extraction? Yep, that's one option. Who out there likes pulling lower canines in cats? Fun, huh? I don't like doing that if I can at all avoid it. So extraction is an option. But what we prefer to do is to do kind of like we talked about, well, we haven't talked about in the webinars yet, but doing what's called coronal amputation and vital pulp therapy. And what that means is we cut the tooth down, get rid of what is painful and what's causing the trauma, and then we have to treat it. So here's the lower canines, here's coronal amputation and vital pulp therapy, where we're actually just putting in some fillings on top. In older cats, this is a not fun procedure to do. So we generally in older cats will do root canals because it's just faster for us to do it. And then when you're done, you look like this. You still have the teeth to keep the tongue in. You don't weaken the jaw. You don't chance breaking the jaw. Much less painful for the kitty than an extraction. Extraction is an option if that's the only thing you can do. But I'm telling you what, this is a much better option for everybody involved, because I'll tell you what, I can do a root canal in half the time it takes me to extract an older cat's canine. Now, if they have stomatitis or if it's any disease or there's any other disease to it, yeah, I'll go ahead and do an extraction on that tooth. Okay? We'll go up and see what questions that we have up here. No, the question was, can you do a restoration on an early resorptive lesion? Unfortunately, the answer is not, is no. They used to do it many, many years ago, back in the 70s, actually before I was a veterinary, before I was in high school, they were doing this stuff. They were trying to do it. That's why they talked about glass ionomer. You might see in some of the older textbooks, they talked about it. That's when we thought it was a caries like you and I get. It's not. It's a lesion that is progressive. It's going to get worse. It's going to keep right on going. And what our experience was is that we put a filling in, and I've done a few of these because I had clients that insisted on it, and 6 months later, the filling falls out and you're back where you were. So the answer is no. So when you extract, just to repeat, when you extract an upper canine tooth, 30% of the time, you can develop that lip catching thing, where the upper lip sucks in and the cats bite on it. So that's why I kind of try and avoid extracting upper canines. But again, you guys at least should do, you should at least inform your owners that it's a known complication. It can happen. Do I have the same approach with the extraction of a mandibular carnassial tooth? Oh, Robert, that's a great question. It's not in this lecture. Maybe it's something I should do a newsletter on. What Robert's talking about is if you take out a lower first molar in a cat, sometimes you get a little bit of inflammation and the upper fourth premolar will come down and hit on it. And it'll develop something called a pyogenic granuloma. And it's just this inflammatory area right on the outside of that molar gland. You know, Robert, that's a great question. I don't know if I've ever like just gone in and prophylactically extracted an upper fourth because I'm extracting a lower first. I think the incidence of pyogenic granuloma is much lower than lip catching. I'd say it's probably, you know, maybe 1%. I haven't had a lot of the cases, so I probably wouldn't do it prophylactically. But if you see it down the line after you've done an extraction, then I would take out the upper canine or the upper fourth premolar as well. Have you ever used a composite button on the mandibular canine to push out the upper lip and avoid trauma? No, I'm not sure that would. I'm not sure how that would help unless you're making it longer. I know some people just tip it down and do a bonded sealant, and they think that's enough. But no, I haven't tried it. I've never seen it reported. So if it's reported and it works, that would be a better option, I think. All right, eosinophilic granuloma complex. We do see this in Siberian Huskies on occasion. We do see this in Cavalier King Charles Spaniels on occasion. But cats are the ones that typically get it more. And there's several different forms of it. And this is one that we see not infrequently on the philtrum. This is like an indolent ulcer, and we see it not infrequently in this area. And unfortunately, this mimics cancer pretty bad. And so you've got to make sure that you get a biopsy of this, because this cat was literally brought in for euthanasia. And it said, oh, your cat's got cancer, he's going to die. And they're like, well, we should biopsy it. So we did. This is back in my general practice days. And that's an eosinophilic granuloma. This actually ended up to be a flea allergy. We booted it off to the dermatologist, and I'll talk to you about that in a minute. But they got him on flea control, a little bit of steroids, and we grew this kitty's nose back. But one of the cases I really like to present is this guy. This guy has got this wicked lesion here, and he's got a huge oronasal fistula. And this cat has had this lesion for 5 years. And the reason they had the lesion for so long is because as soon as he walked in to his family vet, his family's vet said, oh, he's got squamous cell and there's nothing we can do about it. But they didn't biopsy it. And so the problem is, without a biopsy, you don't know what it is. So they just assumed that their cat was going to die, so they didn't do anything. Well, 5 years later, they end up in our specialty practice, and the internist is seeing him for, I think, inflammatory bowel disease. And they looked in the mouth when they anesthetized him to do the endoscopy, and they're like, well, what's going on? And then they said, well, there's nothing we can do. And he's like, if that was squamous cell, he'd have been dead 4 years ago. So they sent it to me, and I biopsied this lesion, and it is also a eosinophilic granuloma complex. So after I biopsied it, I booted it off to the dermatologist. You're going to ask me, Dr. Niemiec, how do you treat these? I boot them off to the dermatologist because I'm a surgeon at heart. I like to cut things. I like to cure them. I don't like to pothold. I don't like to deal with steroids and drugs and allergy testing. So what I recommend you guys do, if you see an eosinophilic granuloma in a cat, refer to the dermatologist. What are we going to do? Well, we want to do a really, really good allergy screen. We want to rule out everything that could be allergic and food allergies, food trials, all that kind of stuff. A lot of these are allergic in nature. Flea control, desensitization, all these things are something you want to do. If everything is normal, you can't find anything, cyclosporin, steroids, stuff like that, any typical anti-inflammatory type drug will be helpful for this lesion. I thought I had another question. I do. How would I control bleeding after the biopsy? It wasn't too bad. Generally, the way I control bleeding, ideally, if you can ligate it. I mean, that's the best thing. If it's not one vessel, because it's kind of that diffuse stuff that you see in the mouth, two things. Cautery. Like I said in the emergency lecture, I have those little battery-operated cauteries. And two, vet spawn or gel foam. I think they're interchangeable to me. They work really nicely. Those are the two things. Hemoblock, there's a lot of products out there that work quite well. I'm sure I'm missing about a dozen. But in my practice, we typically use gel foam. It works quite well. Going down. Oh, yes, thanks, Kimberly. Thanks for asking. Yes. So to finish up the story, thank you for getting me back on track there. Yeah, so what I did is I kicked it off to the dermatologist, and they got all that inflammatory tissue back to being nice and healthy. And then about a month or two later, I came back and I took out the upper canine and I took out the upper third premolar. I got to leave the upper fourth, but I took out the upper third premolar and the upper canine. The upper second was already gone. And then what I did is I took those teeth out and then I closed it so it would heal. And then I came back again and made a big buccal mucosal flap and rolled it over there and cured it. So yes, good question. Thank you for bringing me back onto track about that. It wasn't the easiest surgery in the world, but it actually worked out quite well eventually. All right, moving on to everybody's least favorite subject here. And this is what we're going to spend the majority of the rest of the lecture talking about is caudal stomatitis. I'm just going to throw in really quick when we talk about lumps and bumps like this, because I don't have a specific spot of cancer in here, because there's not much to say about cats and cancer other than this. Squamous cell looks a lot like this, and you can see productive and you can see destructive. Okay, and I talked about in the very first lecture of this series that you see this destructive stuff, it could be cancer as well. So any lumps and bumps in the mouth of a cat should be biopsied, and they're squamous cell until proven otherwise. Squamous cell in cats sucks. It's really hard to treat. Same with fibrosarcoma. Cats very rarely get benign lesions in their mouth. They do, but it's rare. So again, biopsy everything. And if it's squamous cell, if it's really forward, on like the mandibular incisor area and you catch it early, a mandibulectomy will work for the really rostral squamous cells in cats. That'll work. But honestly, maxillary squames in cats, they just don't do well. They just don't. You can't get surgical margins on them unless they're tiny and around the canine, maybe. You generally can't get surgical margins. They don't respond well to radiation therapy at all. Now, there is one report of doing radiation and chemotherapy accelerated program, and that was like 7 cats, I think. Don't quote me on that. And it seemed to help. So you can look up that article if you want. But the oncologists that I work with, they're just like, yeah, no, dude, we don't believe in that. I don't think that it helps very much. All right, so now let's talk about caudal stomatitis. This has had a bunch of names in the past. Why? Because we don't understand it. We wish we did. So we've called it gingivostomatitis, lymphoplasmacytic stomatitis, you know, blah, 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 blah. It's had tons of names. Current terminology for the AVDC, this may change in the not too distant future, is caudal stomatitis. Why? Because it's inflammation, can you see my hand? Inflammation in the back of the mouth where the jaws hinge together. So if our canines are up here, this is where our jaws come together back down in the mouth. When you have inflammation back here beyond where the teeth are, that's caudal stomatitis. You have inflammation everywhere else, that's not caudal stomatitis. So stomatitis is a misnomer. Stoma is mouth, itis is inflammation. If you burn your tongue on hot coffee, you have stomatitis. If you have periodontal disease, you have stomatitis. When we talk as veterinary dentists about stomatitis, we're talking about inflammation in the very back of the mouth. It's called caudal mucositis. It is no longer, oh, by the way, fasciitis. Fasciitis is actually further down in the mouth. What we talk about, the diagnostic piece of this, is caudal mucositis, inflammation in the back of the mouth where the jaws hinge together, okay? There she blows, okay? So when you have this inflammation in the back of the mouth where the jaws hinge together, that is stomatitis. If you don't have inflammation there, no matter how bad the inflammation is in the rest of the mouth where the teeth are, that is periodontal disease, not stomatitis, okay? So why does this happen, Dr. Niemiec? I have no idea. There have been so many thoughts behind this. You know, we'll go back to this. You know, Bartonella, oh, you know, we tested all these cats and they all had Bartonella. Well, what they forgot to do was test normal cats and they have Bartonella. So, you know, it's a positive thing, but the negative is not there. Upper respiratory viruses. I was in China last year, not this year. I was in China last year. I was actually, you know what's really interesting? I should be in China right now. If COVID hadn't happened, I would be doing this from China currently. But when I was in China, I had a veterinarian come up after my lecture and say, calicivirus causes stomatitis. Does? Yes. How do you know? Well, because I've tested, I've run PCR, calicivirus PCRs on all my stomatitis cats, and they all have calicivirus. Okay. Have you tested any cats that don't have stomatitis? Well, no. So how do you know that all cats don't have calicivirus? Because you vaccinate for it. They're all going to have immune bodies. Oh, that makes sense. So test normal cats. And if you test a bunch of normal cats and they don't have it, then call me again. So we do know that bacterial plaque plays a role. We do know that there is something with it, but it's not everything. It's not everything, okay? There is something, but it's not everything, okay? So bottom line is, what we think is that there's multiple etiologies of this disease process, okay, that look the same. So it's more of a syndrome as opposed to an actual disease, you know, like parvovirus, you know, type of a thing. This is a situation where I believe that it's things that look similar that are different, okay? What do you see? I think most of you guys get this. These cats are miserable. this is really the exception to the rule. Like I said, these cats will stop eating, okay? They will paw at the mouth, they'll stop eating, they might drop their food, they might have halitosis. The big thing is they're gonna go to the food bowl and then scream and run away. There you go. There's a stomatitis cat. The other things that you may see is drooling, especially with pus in it. And these cats will stop grooming because they're painful. So you might see that unkempt appearance in these kitties. And that's another sign, but really it's pretty classic. Okay. So what do you see? Well, you see inflammation. You see a significant infection, significant inflammation, bright red inflammatory stuff. It's not hard to see a stomatitis cat. They're pretty obvious for the most part. Really bad inflammation, really bad pain. And then again here, really bad inflammation to these teeth. One thing I will say is 99.9% of the time it's bilateral. It is. You see it bilateral, but not always. So if you see unilateral stomatitis, I would probably biopsy that. We'll talk about diagnostics in a second, but I would really, wow, I do look scruffy, don't I? I would say that if you see it unilaterally, I would definitely biopsy. I don't generally biopsy anymore because it's pretty classic. You're not wrong too. I will tell you, go ahead and biopsy if it makes you feel better. But this, when you see this inflammation in the back of the mouth, that inflammation where those jaws hinge together, that's stomatitis. If you look at this cat, the inflammation to where the teeth are isn't bad. I mean, there's a little bit, right? But it's horrific back in the back of his mouth. This is a cat that is in misery. He's not eating. He's not grooming, etc. So I'm going to talk about feline juvenile periodontitis at the end of this lecture. But caudal stomatitis, they both have inflammation of the gingiva. The difference is the caudal stomatitis. So this is a cat, again, jaws hinging together, inflammation in the back of the mouth. This is caudal stomatitis plus the cat's miserable. Same thing here. This is a post full mouth extractions that didn't work. We'll get there in a minute. But horrific inflammation in the caudal mucositis area. Here's a cat, horrific inflammation, right? This cat orally, periodontally, has as much, if not more, inflammation than those other cats did. But look at the back of the mouth. Where the jaws hinge together is perfectly pink and happy. This cat has significant periodontal disease. He does not have stomatitis. Okay? That is how you diagnose stomatitis. You don't need a biopsy. You don't need a blood panel. You don't need me to tell you. You look at the back of the mouth. If where the jaws hinge together has inflammation, you have stomatitis. If it doesn't, you have gum disease. Can't make it any easier than that. Okay? This is juvenile periodontitis. I'll talk to you about that in a minute. Okay? So again, it's a clinical syndrome. It's not a actual thing that you're going to see. And oh, by the way, if you biopsy this, okay, it's going to come back as lymphoplasmacytic stomatitis. That's what your biopsy is going to say. Lymphoplasmacytic gingivitis is plain and simple inflammation. You're going to see it anywhere. It does nothing for your diagnosis, okay? I see a lot of cats referred to me. I get a lot of questions. Well, my cat's got stomatitis. Right, it does. This cat has stomatitis. It has inflammation. Stomatitis, right? Stomatitis, right? But he doesn't have caudal stomatitis. Different disease. So biopsies, if you want to, sure, do it. But it's not going to give you an answer. Your answer is going to come by looking in the back of the mouth. There's your answer. Okay? So x-rays are critical. You want to find retained roots, evidence of cancer. That's the one thing. If you get this pad under and you're like, well, it's bilateral, it looks pretty standard, but ooh, there's some moth-eaten areas, biopsy first, okay? And you're gonna need to take out any toothless disease. So we're gonna talk about treatment in a second, but dental radiographs are critical. And again, I talked about this briefly. The only reasons that I would biopsy, and again, I'm not gonna tell you that you're wrong to biopsy it. I don't think you need to. I used to when I was young and silly, like 15 years ago I did. But after so long, I don't biopsy anymore. I don't waste the time under anesthesia. I don't waste the cost because treatment's going to be expensive. So when will I biopsy? Like I said, if it's one-sided, okay? If you see any hinky changes on your dental x-rays, go, maybe you want to biopsy this to make sure it's not cancer. What you're going to see if you do histopathology is mostly plasma cells with some lymphocytes, and that's what your pathologist is going to say. There's nothing wrong with their read if they tell you he's got stomatitis or lymphoplasmacytic stomatitis. It's just it looks the same under the microscope. How do we treat it? Oh, I will tell you that this is my least favorite disease to treat, being a veterinary dentist. Why? Because pretty much everything else I can fix or not fix. And I can tell the client from day one, your cat has a broken tooth, I can do a root canal. Your cat has perio, I'm gonna have to do extractions, but that perio is going away. Your cat has cancer, I can cut it out, or I can't. But this is the treatment that I would do, and if I'm going to do it, 99% of the time, it's going to work. Cancer, I'm going to say, I have a pretty good reasonable chance of getting it all out. 1 in a million. I mean, they just rarely come in. But, or I can look him square in the eye and say, sorry, I can't fix your kitty. This one, you just don't know. This one, you can do everything right. This is where cats get a little frustrating. You can do absolutely everything right, full mouth extraction, do everything, and it doesn't work. I have a case right now that I'm just, at my wit's end because nothing's working for this cat. There are those cases that nothing works for. Okay, and euthanasia is an option. And we're getting there on this kitty, unfortunately, because just nothing works. So ideally, you rid your cats of pain completely. Yeah, that's great. Okay, that's what we want. But it doesn't always work. And I'm going to go up and see if there's answer some questions real quick before I go on to the other part. Okay. Okay, these are all thank you for the most parts. That's great. Thank you, thank you, thank you. Yeah, so thank you for Elizabeth. Hi, Deb. Oh no, it says hi. So Deb, if you work with Deb, that's great. So those are thankful. Could this in the long run be dietary? Too much carbs in cats or diet contributing to virulence and stomatitis? Joanna, sure, it could be anything. We really don't know, unfortunately. One of these days, we're going to figure out what it is. The thing that I say argues against so much of this is, why do they get better when we take the teeth out? I don't, why would, calicivirus or Bartonella or, anything like that be solved by taking the teeth out? I don't know. And then Patty, excellent point. Excellent point. What Patty said is, I feel like I see households with multiple cats in it, get it bad. And I will tell you that, yes, cats in multi-cat households. And it's not a 2 to 3 cat, but it's these people that have like almost shelters. When you get to that 10 to 15 cat range, I mean, I'm telling you, these cats get it, and they get it bad. Cats that are in single cat households typically respond to therapy. These large multi-cat households, yeah. And again, a lot of these cats are unrelated cats. So I don't know if it could be hereditary, maybe. These are cats that are just rescues in a multi-cat, maybe. And I think, honestly, it's probably stress because cats are solitary animals, but I don't know. Yeah, multi-cat households, they're really challenging. Ronald, yeah, just you, I would say. I would say that I'm seeing him just as much as we always used to. It'd be great if we were seeing fewer of them, but I think we still are. Youngest cat with stomatitis I've treated was about 2. I saw it in, I've seen it in about a 2-year-old cat. That's about the youngest I've ever seen. They're usually middle-aged. Autoimmune, sure, there's something. And that's the thing we're gonna talk about. They're reacting to something. We just don't know what that something is. Personal opinion, we'll get to this in a minute. I think it's the periodontal ligament. I do, and I'll get to why I think it's the periodontal ligament in a few minutes. I do know that bacteria plays a role. I do know that cats that have severe stomatitis and periodontal disease tend to respond better than cats that have clean teeth when we do full mouth extraction. Why? Go back to rule 1, they're cats, okay? So ideally, we would control all the inflammation. We would want these cats fat and happy and no inflammation and doing great. So we want to control the inflammation. So any tooth that has any disease, tooth resorption, periodontal, endodontic, should come out. And then if the client wants to try home care, I will tell you, cats don't like their teeth brushed anyway. just doesn't work in my experience. But if you want to try, if you want to give the client the effort to do home care, try, okay? But unfortunately, in my practice, by the time we see these patients, their mouth is horrible. So getting the teeth out is the key, okay? So there's two types of therapy, and I know I'm going fast here. I'm gonna come back to, I just wanna check everything. So when it comes to treatment, okay, I'm back here. When it comes to treatment, there are two main options, medical and surgical. Okay? Medical is any drugs that are anti-inflammatory. The big one is steroids. Steroids is the big medical therapy. Cyclosporin, although cyclosporin I have not seen work well in cats that have their teeth. You know, antibiotics, haven't seen much response. And they talk about levamisole, gold salts, doxycycline, coenzyme Q10. I mean, dude, you can go online and it'll be eye of newt, tail of toad. Oh my God, this natural, this and that cured my cat of stomatitis. Yeah, your cat didn't have stomatitis. So there's so many things that are out there that are purported to work. I'm telling you what, there's no studies that show that any of them work, with the exception of stomatitis or steroids. Steroids will knock it down. I'm going to talk to you about why we don't want to be using steroids, but that's one thing that will knock it down before the teeth are taken out. So when I do extraction, the one good study, there's a couple other kind of studies, but the one seminal study on extractions in cats was done in France, and we're going to get to why I think there's a difference in a minute. But they did a study in France, and they found out that if you removed the teeth behind the canines, so premolars and molars, you left the canines and incisors, that 60%-ish of these cats would get better. And there's another study that say it's about the same. 60% of cats get better if you take out the caudal teeth. However, in my experience, it's not that high. Yet if we take out all the teeth, we're about, and again, anecdotal, we haven't run a study, anecdotally, we're about 90% long-term successful. There still are some cats that don't get better, but most of them do, okay? And here's where I think that it's periodontal ligament. Veterinary dentists, for the most part, when they take the tooth out, will take a coarse diamond burr and will drill out, do a veloplasty. I don't do a veloplasty normally, but for this I do, get rid of anything that might be the periodontal ligament. Some veterinary dentists, and I don't recommend this, I don't. Brooke does not, it's not saying this, so don't take it and start doing it. But some veterinary dentists drill the bone all the way down to the mandibular canal and the informal canal to get rid of everything. I don't like that. But the key is we're getting rid of the periodontal ligament. I think that's why we have a higher success rate than most general practitioners. Back in the day, 10, 15 years ago, it was because roots were being left behind because a lot of GPs didn't have x-ray. Now, vets are doing a better job, but they're not drilling out the alveolus. So that's maybe one of the keys to this. Is just take a coarse diamond burr and drill that out, and then make that bone baby's butt smooth. Get rid of any inflammation that we have there. And again, here, if there's any inflammation, now again, if that client comes to me and those canines and incisors are pink and happy and beautiful, no inflammation, no redness, no nothing, I'll give them the option of leaving those teeth, but I'll still recommend they come out because I think that they still drive inflammation in the back of the mouth. So we generally do full mouth extractions. And yes, if you're going to ask, do I do it all at one time? Yes, I do. Why? Because I'm a specialist and I'm fast. We generally get full mouth extractions done in our practice, 2 hours, 2.5 hours. I mean, sometimes it's longer because of ankylosis, but 2 to 2.5 hours is about right. So bottom line is that, we will take them all out. In general practice, if you're doing them, first of all, charge a lot. Someone asked before, charge more. It's hard. And if you wanted to stage it, I think that's totally reasonable. If it was me, and you'll see a picture in a minute here of a cat where we left one upper and one lower canine, I used to do that. I don't anymore. But what I would do if I were in your practice and I was staging it, I would, rather than do the teeth behind the canines, come back and do the canines, I would do one half of the mouth. I would do from the incisors back, and then I would come back and do the other side. Partially response to therapy. You know, you'll see if you don't see any response, maybe you don't want to take the other side out, you want to do something else. But also, when you're taking out both lower canines, I used to be afraid of breaking the jaw if you took out both lower canines. It's a risk factor. I don't worry about it too much anymore. But by taking one canine out and then maybe a month or two later taking the other one out, the bone's healed on this side by the time you get there. Is it critical? No. Okay. So I already talked about this. The vast majority of patients will have an excellent response if you get all the teeth out. The study was 60%, 90 to 95% is what we do. Here's an example. I told you this is a cat that's got one lower, one upper canine. Can't really see the lower canine because that, and you can see this cat had horrible stomatitis, completely healed. This cat had horrible stomatitis, completely healed. I just happened to get this picture because he was in, this is back in my general practice days. He was in for something else. I'm like, oh my God, I need that picture. Look at how beautiful his mouth looks. This cat had horrible, horrible stomatitis. If the extractions didn't work, 90% of the time, less now, but 90% of the time is because there was roots left behind. So here's a cat that came in to see me. Why they left this for the first premolar, I don't know. But you can see how horrible that inflammation is still here. I mean, you can see the roots now. There's the upper roots, there's the lower roots. I mean, basically, you know, this was a low-cost clinic. They didn't have x-rays. And honestly and truthfully, they just can't amputated them all. I mean, yes, in my opinion, is this not proper standard of care? Yes, it's not standard of care, but it was cheap, you know, and unfortunately for the cat, it didn't get better. We took the teeth out, the cat got better. Rarely properly performed extractions won't work. And it happens. This is why this is a frustrating disease. And I tell the clients from the get-go, it may not work. You're going to spend a lot of money. I'm going to put your cat through a lot of extractions, a lot of pain, a lot of surgery. It may not work. Now, I've never had a cat not get better. They've just, some cats have still been uncomfortable and still needed drugs. And here's the big thing. This is what I need to drive home to y'all. Something about this disease process, because it is allergic, autoimmune, something like that. So when you have this, the more you're exposed to it, the more severe your reaction is. So kind of like a bee sting. You get stung by a bee, you get a hive, you get stung by a bee, then you go get more inflammation, and then you eventually end up anaphylactic. Same type of thing here, in Brooks' opinion. Again, this is something that's known by most veterinary dentists. It is anecdotal. There's no studies on this. Dr. Lewis did something, and he said it really didn't show, but I'm telling you what, I've been doing this a long time. Over time, medical therapy is going to stop working. If you start a cat on steroids, over time, it's going to stop working. And what happens, what we see all the time, is a cat comes in, got stomatitis, is miserable, give him a shot of Depo, 5 to 10 milligrams, I'm pretty conservative. Cat's a whole new cat in 2 days, lasts for 2 months. Then the client's back, cat's back to stomatitis, give him another shot, goes away, and you keep doing that, and then it's 5 weeks, then it's 4 weeks, then it's 3 weeks, then it's 2 weeks, then it doesn't work at all. I will tell you, if you see a cat and you diagnose stomatitis and you give him a shot of steroids and it gets better, okay, there's your response to therapy, that's great. Talk to your client about full mouth extractions now. Tell the client before you even give him a shot, yes, I'll give your cat a shot of steroids, it will make it feel better. If it comes back in 2 months, 3 months, 2 weeks, we need to do extractions. If you do that, I will tell you, we'll be at that 90% long-term success. If you give them steroids for a year or 2, and the steroids stop working, I will tell that client that it will not work. It won't. Extractions won't work. It'll help. We need to do it, but it's not going to make the cat better. It's not. It's not going to fix anything. So one of the keys I want to drive home to y'all, medical therapy should be reserved for clients that decline full mouth extractions. And you should talk to your client from the get-go. Your cat should have full mouth extractions. That is what I am recommending. I would recommend your cat have full mouth extractions. If you can't afford it, I get that. If you don't want to put your cat through it, kind of get that. You guys have to really talk to them about the risk-benefit ratio and how they're whole new cats most of the time. And there's the other frustrating thing. But you really need to tell these patients that they need to be taken care of, okay? And tell the client, steroids are lifelong. I'm going to be giving your cat an injection and more and more and more injections. It's not good for your kitty to be on steroids. It's not healthy, okay, to be on it long term. And, oh, by the way, after a little bit of time, we're not going to be able to do the extraction and have it work. So we need to do the extractions, and only clients that have been well educated and have declined that, trust me, they decline it with me sometimes too. If they do, you got to tell them that it's probably not going to work and you're not going to be able to treat it later on. So let's go up here. I'll answer some questions. I'll go back to other things. Let's see, what do we got here? Will you pull out cat teeth, premolars and molars, for future let's see. Will you pull out cat teeth, the molars and premolars, for prevention if the cat had prior medical issues? If it's got stomatitis, maybe. I don't know about if I would do it prophylactically, because again, you have to anesthetize them. You know what? I don't know if big cats also have this issue. I would assume so, because they're cats. But I don't know. I don't know. I don't work on large cats anymore. I leave that to my residents. I will tell you this. I've never seen it in a cat. Recommended extracting ankylosed teeth for caudal stomatitis. Yeah. No, I don't crown amputate. This is, again, and it's not FORL anymore, Scott. It's tooth resorption. FORL was a couple of things ago. I basically, if I see a cat that has evidence of stomatitis and not only stomatitis, but also tooth resorption, I will typically drill those roots out, pulverize them. I hate to do that, but that's one where you got to get that whole tooth out because they're miserable. If full mouth extractions are going to be done, would you still give steroids? Depends on how miserable the cat is. If the cat is, you know, because the question was, if the cat's, you know, the client comes in on, you know, Tuesday, and you're like, yeah, cat's got stomatitis, we need to do full mouth extractions, and they're like, okay, I'm in. You could just go straight for the extractions, and maybe you're going to do it the next day or 2 days later. It really depends on how miserable the cat is. If that cat's not eating and that cat's just absolutely miserable, I would give them steroids to make them comfortable until you plan the surgery. If you're just gonna, if you can get the surgery done right away, because you're gonna do it, you can do it tomorrow, great, just do it. Just jump right back into that. We're gonna get to, Justine, we're gonna get to the cats that have persistent stomatitis here in a couple minutes. And there are some options. It's frustrating. What do you use for post-op analgesia for cats if they've been on steroids? Caitlin, excellent question. Buprenorphine. I would avoid Oncio or Metacam if they've been on steroids, and that's a great reason to not start them on steroids. So you can use the anti-inflammatory. But then on that standpoint, the cat's got an anti-inflammatory on board if they got steroids. So buprenorphine is what I typically use. I'll be honest, I used to use fentanyl patches. I don't know how well they worked, and they're just kind of a pain in my experience. I like buprenorphine. I think it works quite well. Patty's saying, I find the cats with steroids feel better, but the mouth doesn't look that much different. I don't know. I think sometimes yes, sometimes no. You know, but I think as long as the cat's feeling better, I think that's good. Oh, Sharon, excellent question. How long after full mouth extraction do you expect to see improvement in caudal stomatitis? Great question. My experience is these cats will slowly improve for about 6 weeks. Some cats will like go home and eat the next day or that night. And I guess that's probably because they have nerve blocks on board. They can't feel their mouth and they're like, dude, my life is wonderful now for the first time in forever. I don't hurt. So I think that's part of, and then the Valium that we use, or the midazolam is a little appetite stimulant. So that helps too. But some cats will go home right away and eat. Other cats will take longer. But I tell clients 6 weeks. 6 weeks is when you're going to get maximum effect from the extractions, and that's when we would have to start talking about medical therapy if necessary. Cimbadol is a great drug, Kimberly. It lasts for a full day. I have not started using it in my practice, but I do like it. I think it's a good idea. I just use regular buprenorphine, to be honest. I think it works just fine. The reason that we don't do it in our practice is just because of timing, not being a specialist. There's absolutely nothing wrong with Cimbadol. I think it's a great drug. And for those of you guys that don't know what Cimbadol is, it's a 24-hour buprenorphine injection. I believe it's a Zoetis product. Would you avoid using steroids at full mouth extraction? Yeah, I think I answered that. If I can do it, and again, Michelle, it comes down to how miserable the kitty is. If the kitty's miserable and just not eating, and the cat just is in pain, and you're going to do extractions, you know, in a week or two, Yeah, make the kitty comfortable, treat the kitty properly, get them steroids, get them eating, get them happy. If you can do the extractions right away, do it, and then you can avoid that completely. Do I send my full mouth extractions home the same day? Yes, I do. I used to keep them overnight, but I just find that cats like to be home. They do. They don't like to be in the hospital. I do keep them for a little bit longer to make sure they're nice and hydrated. And what I tell my clients is just to make sure your cat is staying hydrated. If they go home and they don't eat for a couple days, then I would be concerned and maybe bring them in and get some sub-Q fluids and appetite stimulant. Do I give depot injections post-surgery? No, I don't. Unless, again, sometimes, I mean, I wouldn't do it just as a point of case. What I would do is if the cat's miserable, like let's say we do extractions and 3 or 4 days later, the cat's still not eating, the cat's still miserable, then I will give them a shot at depot to get them through until the extractions take effect. And in my practice, have I seen breed prevalence? No, not really. Siamese maybe, but no, not really. I haven't seen a bad thing. All right, let's talk about other treatments other than extraction. If you're going to ask me, Brooke, how do you treat stomatitis? It's going to be full mouth extractions. You may hear of laser therapy, and I'm meaning cutting laser, okay, the diode lasers. There's no published reports that it's beneficial, none, in my opinion. There was one study that I think it was out of UPenn that looked at it, and they did probably 5 or 6 treatments, and the cat would feel better for a little bit and then come back. When did the cat get better? When they eventually took the teeth out. I used to work in an area where there was a person who was a quote unquote dentist. They weren't boarded, but all they did was dentistry, and they were huge believers. He's like, oh my God, I fix all these cats with stomatitis. Yeah, no, I pull a lot of teeth after you've done it. Never seen it work, can't recommend it. Now, cold laser as an anti-inflammatory, sure, that'll help. It probably won't cure it, but post-operatively, sure, I think it's a great product. I think it will help. I don't know that it helps, but there's no studies, unfortunately, but I think it does help. Here's the other thing for resistant cats, other than what do we typically do? We typically do, we'll get to medical therapy in a second, we typically do cyclosporin. Cyclosporin has been my drug of choice, and the dosage would be whatever it is. I use Atopica personally, and so it's a really good product. It works well. I use it at the labeled dosage. If it's not working, you can do blood levels, but Atopica is really the thing that I typically use. The only other thing that I have heard any really good positive response to is stem cell therapy. A study out of UC Davis showed that in resistant cats, that they did improve with stem cell therapy. The problem is it was 7 cats. And out of those 7 cats, I think 4 of them got better, 2 got really, really better, 2 got meh better, and 3 had no response. So there is an expense. It isn't a nothing treatment. I mean, they have to do surgery to get the stem cells out, but it's an option for resistant cases unless you're going to keep them on medications for the rest of the time. So going into, I think I had one question up here before I get into the medical standpoint of it. Do you use therapeutic laser to reduce inflammation? I don't, but I know some people that do. So therapeutic lasers, certainly can be an adjunct therapy, and there's nothing wrong with that. Using it post-operatively, I know there's a lot of information out there, especially on the human side. So like I said, medical therapy is hard to deal with. It's really one of those things that there's lots of drugs they talk about. So I've already talked about this. You clients have to be informed that over time it's going to stop working. It is. And 2, they're not fun, happy drugs. So it's not good for anybody. And like I said before, the longer you delay the extractions, the worse the prognosis is going to be. If you're going to, if this is a client that says, not doing full mouth extractions, plain and simple, I know you talked to me about it. I know you spent a half an hour. I know I watched Dr. Niemiec's video online. Can't afford it, won't do it. Okay, there you go. If you're going to do that, then again, you should do a cleaning and extract anything that's diseased. Take out the tooth resorption, the broken teeth, the periodontally diseased teeth. Get rid of any retained roots. And then the client has to do home care. Okay, they have to do home care. If they're not going to do home care, they can just forget it. But if they're going to do home care, they can do that and then try medical therapy. What are the medicines that we talk about? Well, Antibiotics may help. Honestly, most cats will relapse even while on antibiotics. So it's temporary at best. You know, typical mouth drugs, you know, Clavamox, clindamycin are the two things that I typically use. But honestly and truthfully, to me, this is kind of a waste of time. Waste of time, waste of money. Not good for the cat's GI tract, not good for pilling cats as miserable. Antibiotics, in my opinion, are not something that I would ever use for stomatitis. Steroids are the mainstay. By far the most commonly used, by far the most effective pre-extractions drug is corticosteroids. In my experience, and again, this is Brooke's experience, injectable tends to work better than oral. You know, I know some people have my long-term prednisone orally. You know, I use Depomedrol if I'm going to do it. And I, like I said, I'm pretty conservative, 5 to 10 milligrams. Why does it make a difference, injectable versus oral? It's in the cat. It's there. You know, it's kind of like we talk about convenience in the cat for 2 weeks. Why does it work? Because it's in the cat. Pilling cats is miserable, especially when you have a cat with stomatitis. So you got a cat that doesn't like to be pilled in the first place, and then it's got a painful mouth on top of that. So I really, really think that the injectable works better, at least in my experience. There are problems with steroids. We all know about that. I'm not going to talk too much about that. So really, I've already said this. I'm saying it again, just in case people stepped away to grab a glass of wine. And if you did, I'm incredibly jealous because I have to still drive when I get done here. So I'm drinking sparkling water. So you should have this discussion with the client before you do anything else. Chronic corticosteroid therapy should be only performed as a last resort. Okay, your client should be informed of that, and it should be avoided. Now, cyclosporin, there are no reports of it being effective before the teeth are extracted. Okay, so you can try it. I wouldn't, because I don't think it's going to help. But Dr. Melinda Lomner did a study, and this is kind of the current drug that we use as veterinary dentists for resistant cases. Again, it's safer than steroids are. It works well in most cases. Again, it is a daily drug, unfortunately, and it's oral, so it's a challenge. I don't think transdermal stuff works very well. I really don't. So cyclosporin is what we're going to do in our resistant cases. I wouldn't use it pre-extraction. Again, I have to take that out. Please forget that, not approved in cats. It is approved in cats. That's an old slide I have to fix. And there are issues. You have to be careful with cats and kidney and liver disease. Again, fungal infections, protozoal infections can happen as well. One thing that you're going to read about, and there is a study on this actually, is feline. I think there's a study. I think they published it. Is feline interferon. Couple things. It is an antiviral effect. It also is immune modulatory. So it brings about a return of local good immune function, and studies have shown efficacy in resistant cases. But again, it's not a primary drug. Here's the thing. I told you before that the caudal extractions study was out of France. I personally believe that it's a different disease in Europe than it is in America or North America. I really do. Because when you talk to veterinary dentists in Europe, because I am boarded in Europe as well, I speak over there all the time. I have lots of friends that are board certified dentists in Europe, and with resistant cases, they find that interferon works quite well. Most veterinary dentists in America or Canada, and me for doing this for 20 years. Number one, to use feline interferon in America, you have to order it from Europe because you can't get it in America. So you have to buy 5 cases or 5 vials of it and hope that it gets through customs. And it typically does with the compassionate use permit. But the problem is you have to buy it, the whole thing, and hope it gets there. But number two, it just doesn't work. I've done it many times. I haven't seen it at all work. You can try it. It's safe. The way that most people will do it, most people in Europe, is they'll take half of it. So it's 10 milliunits. They'll take half of it, anesthetize a cat, and inject it locally into the hot spots. And then they'll take the rest of it, the other half, and to dilute it into 100 mLs of sterile water, and then freeze it in 10 ml aliquots, and have the client give the pet 1 cc orally for 100 days, which means it needs to be frozen in the interim, which is kind of unfun too. Again, never seen it work. And most veterinary dentists in America will tell you the same thing. Other things that you can read about medically, eye of newt, tail of toad, right? Lactoferrin, gold salts, levamisole, doxycycline, coenzyme Q10, all those things are possible. I will be honest, haven't seen any of them work, okay? So in summary, plaque control, in my experience, doesn't help these cats. Brushing the teeth, cleaning the teeth doesn't help. At the time of the, right now, I'm telling you, on April 30th, 2020, pull the teeth, 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 pull the teeth. Now, pull them as soon, pull them all, pull them now. And this is gonna be the best long-term success rate for your kitty. If it doesn't work, then I would do cyclosporin first. Going back to some questions here. Any experience with CBD oil? No, I've never used CBD oil. I know some people do. I don't, sorry, Justine, I have no experience with CBD oil. Do I always check blood glucose prior to depot injections? Caitlin, no, not a bad idea. Never a bad idea, especially if this cat's been on it for a long time. And you really should. If you've got a cat that's on steroids or cyclosporin, you probably should be doing Q6-month blood tests anyway, but it's not a bad idea, but I don't. Have I ever used a antiviral medication? No, I haven't, Elena. I don't know if it would work, but again, I don't think this is a viral thing. I will tell you that cats that have FELV, FIV tend to get it worse, and they don't tend to respond as well, but I don't think they get it more commonly. If FIV positive cat needs anti-inflammatory medication post-extraction, would you consider steroids longer or change to cyclosporin? I always prefer cyclosporin. I think cyclosporin is a safer drug. Thanks, Joseph. Joseph's liking the scruffy look. I don't think Kimberly would appreciate it. 2 hours, hour and a half-ish for questions. I mean, it's scheduled for 2 hours. You get 2 hours of CE, but I'm probably not gonna go for the full 2 hours. I'll probably got about another 10 minutes or so worth of lecture, one more thing to talk about, and then that will be it from there. So last thing I want to talk to you guys about is juvenile periodontitis. Okay, we just talked about stomatitis. This is the disease process that always gets confused with it. So the clients, veterinarians, will see this as stomatitis, but it's not, okay? But then we are seeing this more commonly. I have no idea why. So juvenile periodontitis, why are we seeing it? What causes it? I don't know. Again, I'm gonna go back to that very first slide. They're cats. They don't pay attention to textbooks. So in humans, there is an immune dip in the puberty period, okay? Among all the other things that happen during puberty, you also get gingivitis. Same thing with pregnancy. There's an immunity dip and you'll get peripubertal periodontitis. Say that 3 times fast, okay? So we think there's immune dip. That's what we think. There is a genetic predisposition to this in Eases, Somalis, Siamese, Burmese, Maine Coons get it as well. But it's something that's an immune dip. Now, stomatitis is too much immune. This is not enough immune, okay? So they're having a poor response to the bacteria, okay? So what you're gonna see is significant periodontal disease, significant gingivitis in a 6 to 9 month old cat. It happens as soon as the adult teeth come in. Honestly, I've never seen it, but it's been reported in cats with their deciduous teeth as well. I've never seen it, but it's certainly possible. There's severe inflammation, but it's not in the back of the mouth. It's not in the back of the mouth, okay? There's 2 different syndromes of it. One has got gingival enlargement and one that's just advanced perio. You just get bone loss really quickly. And where you're gonna get the bone loss mostly is in the molar teeth. Okay, first molar, that little guy in the back on the top, and that lower carnassial tooth. So this is what you'll see. Looks pretty similar to stomatitis, right? I mean, it looks exactly the same. Stomatitis doesn't get as much gingival enlargement, but you certainly can see it. But here's your X-ray. This is a young cat. He's about 1.5 years. Look at how much bone loss he has to that first molar. That tooth needs to be extracted. So these cats get significant perio disease right at the beginning, okay? The other one that we'll see is just gingivitis, but you'll see really severe hyperplasia. So here it is, you've got this gum overgrowth here, you've got gum overgrowth there. Now again, there's no bone loss, it's just severe hyperplastic gingiva, and that hyperplastic gingiva will act as an area that will allow plaque to get in there and start causing more gum disease. So it definitely needs to be treated. How do we treat juvenile perio? So again, remember, no inflammation where the jaws hinge together and the cat is fat and happy and eating and probably has halitosis. These cats generally have bad breath. You're generally going to first see this 9 months of age-ish. Usually by a year of age, you're going to see this. One thing I want to say, I have had one cat that had juvenile perio that then developed stomatitis. So they might be related, but in general, they're not, okay? So how do we treat this? Because I get it referred all the time for full mouth extractions. They don't need full mouth extractions. Sometimes they get bad enough to need it. But generally, you can treat this just like every other gum disease in an animal. Number one, if there's gum overgrowth, trim it back. I generally use a coarse diamond burr, just kind of cut it back. You can use a blade. I don't usually use laser. I don't like laser very much, but you can use that. And then treat it just like you would treat any other periodontally diseased case. If you've got bad perio disease, like I showed you, pull the teeth. And yes, like I said, molars will often need to be extracted at 9 months of age. Then get the client on home care. And if you get the client on home care, you get that patient down at 9 to 12 months. You clean the teeth, trim back the gums, take out what's bad. Get the client on home care. And I really like for this particular disease, the two things I think I might have mentioned before, but the two products, other than just brushing, okay, which is best, the two products that I would probably recommend for these cats. One is called 1-TDC. 1-TDC is an esterified fatty acid. It's available. I know that Covetrus has a labeled version of that. They have studies that it does decrease periodontal disease, and there was a recent study put out by Dr. Anthony about stomatitis. So I have never used it in stomatitis, but he has. But I'll tell you with perio, it helps the inflammation. So that's one thing, and cats like the taste of it, and it's good for their joints, although cats don't usually get arthritis. And the other product that I really like for this, and there's lots of other things you can do, but there's a product called MaxiGuard or Orizin. They're very similar products, and it's from a company called Addison's Biologics. I think both of those products would be something that I would add into this cat. But if you clean the teeth at 9 months, get the client on home care, and then at, say, 18 months, you clean the teeth again, about 50% of these cats, will revert and be normal. Again, anecdotal, it's a guess. But about 50% of these cats will be anecdotal. For other cats, it's just a lifelong struggle. And again, you can treat it. I mean, there's dogs, little dogs get really bad. Oh, sunset. Little dogs get really bad periodontal disease. And you can maintain their teeth if you brush and do regular home care, just like the same thing these cats. But if you're treating these cats and you're cleaning the teeth and the cat's just chronically inflamed, pull the teeth. If you take the teeth out of these cats, they will get better. That is the one really nice thing about this disease process. Stomatitis, they don't always get better. Juvenile periodontitis, they always get better. So that's the other good thing that I can tell you. So in summary, and then I'll come back and I'll take pictures again, or take questions again for a few more minutes. Oral disease is incredibly common in feline patients, and they almost never show overt signs. They almost never do. Cats are unique. They don't show things. They have, numerous maladies that are not in other things. So keep up with the literature, keep up with, paying attention to what we're talking about. Don't get frustrated. And that's where veterinary dentists are. We keep up with all this information, and that's why we try and pass along to you the most up-to-date information. So that is the lecture. I'm going to go in and take some questions here. All right, Annette, where can we see the recorded lecture? It's going to be on our website. So if you guys want to see any of the recorded lectures, as of now, it's just the ER lecture that the first one that I did is on there. If you guys were not live on for that, it is recorded, it is online. If you want to go on and watch it and get CE credit, you have to take the exam, and the exam will send an email to me, and we will send you a certificate. This recorded lecture, because I'll be pseudo off the grid, on and out and out of my main office for a little bit. It'll probably take a week or two to get on the site. I generally send emails to let you know, but it's all on our website. If you go to the if you go to Dog Beach Dentistry or dogbeachvet.com and you click on for professionals and go to online CE, it'll bring it right up there. And a couple, I know one is available now. With my experience, is there any sex or breed disposition to age related to the young? So for juvenile perio, yeah, I tend to see it more in the Eases again, the Tonkinese, the Burmese, Somalis. They typically get it, but I've seen it in every breed. No such a thing as a dumb question. How do we make a choice to treat based on clinical sign alone? We would need to convince the owners early in disease to do a full mouth extraction. Well, basically, if you've got a cat that's under and he's got, you know, juvenile perio, if it's diseased at all, I'd probably take it out because it's just a snowball effect. And the sooner those teeth get out, the better those animals do. So I would probably, you know, give the cat until they're 2 years of age. And if that cat's mouth is still hot and miserable, I would probably think about extractions. The two different syndromes of juvenile periodontitis, basically it comes down to hyperplastic gingivitis, which is basically they don't get a lot of bone loss. They just get hyperplasia. They get that, it's almost like a boxer. They get hyperplasia, but it's really inflamed. That doesn't typically get bone loss really quickly, and doing the gingivectomy and getting that cat on good home care has got a pretty decent prognosis, as opposed to the other one where you have the advanced perio. That one is going to not, that's going to be a lot more likely that you're going to have to do extractions on that. What's your treatment prophy duration protocol after the initial diagnosis and treatment? I think it depends on the therapy, but we recommend prophies every 4 to 6 months until resolved. Yes, Aaron, I think that sounds reasonable. You know, I would say 6 months is what I say, but I try and keep an eye on the cat and see how bad it's getting. But certainly, you know, I have cats and dogs that come in every 3 months for their cleanings. They're pretty rare, and they're special clients to do that, really good ones. 2-year-old cat this week, all premolars and molars were involved. Half the crowns were gone, leaving only roots. Yeah, and that's the one thing. When we talk about those type 1, what you're talking about, Ronald, when you have the premolars and molars having this severe periodontal inflammation. And then secondary to that, you have resorptive lesions. The one thing about tooth resorption in cats is the type 1 lesions, the type 1s that, don't have the replacement resorption. Those can be associated with gingival inflammation. So you will see in cats with stomatitis or juvenile perio, you will see type 1 tooth resorption every once in a while as well. So yes, and again, the canines and incisors are fine. Yep, that's exactly what it is. It's exactly juvenile periodontitis, and then you get, on top of that, you get that. Regarding extractions, would you take a tooth root out when the gingiva is fully healed on top, no crown, and you can see a ligament on inflammation on radiograph with no inflammation? Ishmael, yes, I would. I'm sorry to say, and I know for a long time, people would say, well, it's quiet. I don't see any signs of infection, so it's quiet. Two things on that. I used to do the same thing, but more and more veterinary dentists have started to say, you know what? If you can see something that's not resorbing and you can see a root on there, it should come out. Personally, I can't tell you how often I have looked at an x-ray and I've seen a root and it's been, you know, totally normal looking. No lucencies at all, no bone loss, no swelling, no inflammation. I've said, you know what, I'm gonna take it out because I can see it, and I make an incision and pus shoots out of that hole. So that tooth was horrifically infected, 0 radiographic signs. I think when we start doing more cone beam CT, we'll start seeing some more of these, like actually seeing it as opposed to assuming they're quiet based on x-rays, because x-rays are not good. They do not show the early signs of infection. But I'm gonna steal this. This came from, if any of you guys are in Canada listening, Dr. Fraser Hale. We were talking about removing the roots. The diplomats have a Yahoo group that we chat about all the time. And so we have questions because, dude, as specialists, we see stuff. I'm like, dude, I've never seen this. Has anyone seen this? And usually someone's like, oh yeah, I saw one 20 years ago. Thank God we have this. So we were talking about this very question. Do we take out quiet roots? And the thing about it is, where people kind of started that is on the human side. If there's roots that are left behind, they don't always go after them because sometimes they're wrapped around nerves, and you don't want to make your animal, you don't want to lose a person's facial feeling. So they leave some of those impacted molar roots in people. And the thing about it is, people will say, dude, it hurts, or you're going to take x-rays. So Fraser said, I can't see pain. I can't x-ray pain. But I know if I remove the tooth, there's no pain. So therefore, I remove them all. Now, here's a little caveat on that. If I take an x-ray and there's this little tiny speck and I have to drill through a centimeter of bone and needle in a haystack find it, and it's going to be miserable on the cat and miserable on me, I'll go, you know what? It should come out because I'm worried about infection, but it's going to be really hard and it's going to be really painful for your kitty. I'll probably leave it. If I look at it, I'm like, dude, I can get that out, make a flap, take a little bone away and get it out, then I'm going to get it out every single time. I don't care that there's no evidence of any inflammation. What food should a no-teeth cat eat? Whatever they want, man. I mean, cats don't normally chew their food anyway. Usually when a cat vomits, they vomit kibble. They don't usually chew it. So I've got a lot of cats go back to kibble. They do just fine. But soft food is totally fine. Do I use antibiotics for juvenile perio? No, Bill, I never use antibiotics, almost ever, and it's not going to help. With juvenile problem, what do you, well, the question is, what do you recommend for the bad breath after the juvenile perio? Well, if the cat's got bad breath, he's got an infection. So that means that we're not effectively treating the gingivitis, which means we need to go back in and do another cleaning, maybe extract some more teeth. If you can smell bad breath in your cat has current disease and it needs to be treated. And again, you can do home care, you can brush, you can use the other products and go from there. Do I recommend chlorhexidine for juvenile periodontitis? Yes, chlorhexidine is a great product. It's a great, that guy has gone by at least 7 times on his motorized bike. I don't know why. Do I recommend chlorhexidine for juvenile perio? Yes. The problem with chlorhexidine is it's bitter and cats hate it. So if the cat will take it and we good, or if it's a tasteless one, wonderful. If not, no. For juvenile perio, if there's an ulcer in the mucosa from 109, 209, how long would you want? It's not usually 109, 209 that causes the ulcer in the mandible. It's usually 108, 208. So it's the upper fourth that typically does it. If you see it, if after 2 weeks it's not going away, I would extract those teeth. Yeah, are the two products you recommended that would any cat for home dental care if brushing not possible? Yes. Unfortunately, they both require to put your fingers in the mouth. But yes, MaxiGuard, you just put it on your finger. It's like a gel. You put it across the teeth. And One TD is the same thing. It's it looks like wax. You wipe it across the teeth. Gums does a really, really good job. RE caudal stomatitis. Do owners accept the treatment plan for bone mouth extractions? When we were first suspicious of the disease based on severity, how do we help them consent to make the leaf to full mouth extractions, which seems drastic to the pet owners? Do the location and severity of the lesions make sure we are doing the right thing? Scott, if there's inflammation in the back of the mouth, you have caudal stomatitis, the teeth should come out. I know it's hard. I have these conversations with my clients all the time. It's hard to convince them because it is drastic. But what I tell my clients when I'm talking about doing this, if I have 100 thank you notes in my drawer, 99 of them are for cats with stomatitis, because those are the ones that are actually showing the signs that the clients can see. And I tell clients all the time, I hate pulling teeth. If I could avoid pulling a tooth, I would. But this is the one thing that makes it go, okay? So anyway, so it looks like I have answered all the questions. It looks like that we have kept you pretty well to 6:45. So I'm going to sign off now from middle of nowhere. Thank you, Starbucks. Thank you, Covetrus. Thanks, Matt, for helping us out. I'm sorry about the sun in the background, but looks like we got through it. Okay, it looks like I got one last question here. Oh, no, these are thank yous. Thank you all. This will be recorded. Seems like it went really well. And oh, by the way, follow us on Veterinary Dental Specialties and Oral Surgery Facebook. You'll see the pictures of my of the RV trip that I'm doing to take care of animals in our satellite clinics and stories that'll come. So until and oh, by the way, next week I'm hoping to get a guest lecturer, my associate down, or associate partner in New Orleans, Dr. Erin Ripka. I'm hoping to get her to speak on pediatric dentistry. So stay tuned to the Facebook and the Constant Contact. I'll know that in a day or so. And I'm signing off, and I hope everything, you guys are staying safe out there, and we'll talk to you later.